Initially, Checkmate 040 looked at nivolumab in a second-line population, and this was initially a relatively small phase 1/2 study, but grew in size as the data was very supportive. And what we saw there is that about 14% of patients, 14 to 15% of patients have significant responses, and the duration of response is very long. At the same time, there was Keynote 224, which was a single-arm study with pembrolizumab, very similar population of patients, single-arm, about 100 patients. And again, had a very similar response rate, around 15 to 18%. And the patients who responded had a very long duration of response, well over a year. Both these drugs had very tolerable safety profiles. We see immune-induced phenomena, essentially anything, hypothyroidism, hypercolitis, things we've seen in other diseases. There was not really an increased liver toxicity, which obviously was a concern for patients who have cirrhosis. So based on this favorable disease control profile and favorable safety profile, both nivolumab and pembrolizumab got accelerated approval in the second-line setting. Now, after that, there were 2 phase 3 studies done. The Checkmate 459 study, which there was a press release recently that suggested it did not meet its statistical endpoint in frontline versus sorafenib. And then there's Checkmate 240, which I presented at this year's ASCO meeting, which also did not reach its statistical endpoints, but this was a very high bar for statistical significance. There was a clear treatment benefit with this drug, with an improvement of survival of over 3 months. The placebo arm in this population lived 10 months, which is longer than any other study in the second-line setting. And with pembrolizumab, they lived over 13 months. And this was a hazard ratio of 0.78, which is a 22% decrease in the risk of death. And the p-value here was 0.027, right? That is well below the commonly used 0.05, but because of the statistical design, it had to be 0.01 or 1.15. And therefore, we can't say that it met its statistical endpoint, but there was a clear treatment effect. And still, we saw this response rate in this study of 18%, and the duration of response, again, was over 14 months. So it confirmed all this data we saw in the second-line setting. There's still other phase 3 studies pending with pembrolizumab that we're waiting to see the results to try to boost the statistical confidence that this drug is important in liver cancer.